We did our project on treatments for oral cancer. What is oral cancer? Oral cancer includes cancers of the mouth and the back of the throat. Oral cancer can develop on the tongue, on the tissue lining the mouth and the gums, and the area of the throat at the back of the mouth. Some causes of oral cancer may be HPV, tobacco and alcohol use, age, sun exposure, and genetics. Treatment options for oral cancer include surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. Diagnosis of oral cancer is very important. Oral cancer can spread quickly. An oral cancer examination can detect early signs of cancer. During this examination, your dental team will check your face, neck, lips, entire mouth, and the back of the throat for any possible signs of cancer. If the dentist finds anything abnormal, he or she will recommend additional tests and refer you to a specialist. Surgery is the most frequent and first treatment option of oral cancer. During surgery, they remove all cancerous tissue and focus on maximizing cure rates while minimizing impact on body and lifestyle. The treatment plan for surgery is based on the cancer type, stage, and the patient's overall health. During surgery, they will also perform a reconstruction. This may involve using skin, muscle, or bone from another part of the body. Reconstruction aims to restore appearance and function such as speaking and swallowing. Post-op instructions for surgery must be discussed with every patient following their procedure. After surgery, patients go through several recovery phases. The initial recovery usually lasts about 1 to 2 weeks, but full healing can take several months. During this time, pain management is really important. Patients should know that some discomfort is expected and can be controlled with over the counter pain relievers or prescription medications. Swallowing may be difficult at first, so a diet of liquids, protein shakes, and soft foods is often recommended, along with plenty of fluids to stay hydrated. Proper wound care is also essential. Patients should follow their doctor's instructions carefully, keep the area clean and dry, and avoid strenuous activity while healing. Physical and speech therapy may be needed to help maintain strength, mobility, and to improve speaking, swallowing, and breathing. Recovery can also be emotionally challenging, so counseling, therapy, or support groups can be helpful in managing stress, anxiety, or depression. Finally, consistent follow up visits are key to monitor healing, adjust pain management, and detect any possibilities of complications early on.
Another treatment for oral cancer is radiation therapy. Radiation therapy uses high energy X rays to destroy the cancer cells. It does this by damaging the cancer cells' DNA and prevents them from dividing and growing bigger. The most common radiation therapy used for oral cancer is external beam radiation therapy. This usually lasts a month to a couple months. Radiation therapy side effects. Side effects of radiation therapy depends on the size of the area being treated and the specific area or organs being treated with the total dose of radiation and treatment schedule. Some common side effects are fatigue, skin problems, infection. Something that we're concerned about as hygienists is sore mouth, dry mouth, difficulty swallowing, taste changes. Some other side effects are dental problems, voice changes, ear aches, difficulty opening the jaw, eye and vision problems, thyroid problems, and nerve damage. The next treatment for oral cancer is chemotherapy. This is a treatment that uses anti cancer medications to destroy the cancer cells. These drugs are designed to attack cells that divide and grow rapidly. However, because some normal cells also grow quickly, chemotherapy can damage them as well, which may lead to side effects. Chemo can be used in addition to radiation therapy, and this makes the cancer cells more sensitive to the radiation. When chemotherapy is used after surgery to eliminate any remaining cancer cells and lower the risk of recurrence, it is referred to as adjuvant therapy. If oral cancer has spread to other parts of the body, a condition known as metastatic oral cancer, chemotherapy is typically not curative. It can be administered in different forms, but it's most commonly through IV infusion or oral medication. In some treatment plans, both methods may be combined. Chemotherapy side effects can include mouth sores, pain and infection in the oral lining, bleeding and dry mouth, tooth decay and taste changes, fatigue and malnutrition, jaw and mouth stiffness, difficulty swallowing, and tissue and bone loss. A key point is that it's important to maintain good oral hygiene during this treatment as it can help prevent or reduce these complications.
Targeted therapy uses drugs that target specific molecules or pathways that cancer cells rely on to grow and spread. This type of therapy helps destroy oral cancer or helps slow down their growth. A common drug used is cetuximab, which is an epidermal growth factor protein or an EGFR inhibitor that blocks a protein that helps cancer cells grow. Immunotherapy is a type of biological therapy that uses the patient's own immune system to fight the cancer. It works by boosting or modifying the immune's response to target and destroy disease cells. There are two types of immunotherapy, which are active and passive. Active immunotherapy trains the body's own immune system to recognize and attack tumor cells. This involves collecting immune cells such as natural killer cells, dendritic cells, or cytotoxic T cells from the patient, growing them in a lab and then reintroducing them into the body to directly target the tumor. A passive immunotherapy boosts the immune system using external agents. It involves administering pre-made antibodies or other immune components to a person to provide immediate but temporary protection against the disease. It provides a ready-made defense that is effective against oral cancer. This approach is useful when there is a high risk of infection or when the body is unable to produce its own immune response. Some other types of immunotherapies are antibody-based therapies that use proteins from the immune system to fight disease like cancer, infection, and autoimmune disorders by binding to specific markers on cells or tissues. Immune checkpoint inhibitors are a type of immunotherapy that releases the brakes on the immune system, allowing T cells to better recognize and attack cancer cells. Targeted monoclonal antibodies are lab-made proteins that mimic natural antibodies to target specific molecules or antigens on cancer cells. Adoptive cell transfer, or ACT, is a type of immunotherapy that involves collecting a patient's own immune cells, like T cells, modifying them in a lab to enhance their ability to fight cancer, and then infusing them back into the patient. Cancer vaccines, also called therapeutic cancer vaccines, are used to treat cancer. Instead of preventing disease, they are meant to get the immune system to attack a disease a person already has. And then a cytokine therapy uses protein that regulate the immune system to help the body fight oral cancer. While true post-surgery immunotherapy in oral cancer is still rare in current clinical trials, researchers are actively testing immunotherapy around the time of surgery. In one recent study from Frontiers, patients who received immunotherapy before surgery and then follow-up therapy showed high response rates and better survival in strong responders. Patients who achieved major pathologic response or complete pathologic response had significantly better overall survival compared to those who didn't respond as strongly. These findings suggest that adding immunotherapy to surgical sequences may help reduce reoccurrence, but more trials are needed to confirm safety, timing, and long term benefit in oral cancer specifically. Faith, Abby, and I just wanted to thank you for taking a look and listening to our video about treatments for oral cancer. We hope you enjoyed it and learned something. Thank you.